Welcome to the Fordingbridge Surgery. We look after 12,500 patients and we offer approximately 1,940 appointments per week. A lot has changed in general practice over the last few years across the country. We wanted to explain some of the changes and help our patients get the best use from the surgery and from the wider community healthcare team. We know that patients want quick and easy access to their usual GP with a choice of appointments including face-to-face consultations. This is what we want too. However, resources and funding into general practice means that across the country this is no longer possible. And unless the government increases funding into general practice, this is unlikely to change. We have made changes in the surgery to ensure that we make the best use of available resources so that patients get the best possible care that we can provide. In this video, we will explore how we can help patients make the best use of the services available. We'd love you to join the patient participation group if you have some positive ideas that could help us. There's more details on how to do this on the surgery website.
Our website should be your first port of call to seek help, but if your problem's urgent, then do call us or call 111. Before you make contact with us, please do look at our website and see whether you can get to the service you need through our self-referral portal on our website. For example, you can directly arrange a hearing check, get help with an eye problem, self-refer to physiotherapy, check if you can visit a pharmacist for antibiotics for an infection, and also get support with smoking, alcohol issues and weight management. At Fordingbridge Surgery, we don't want our patients to have to wait weeks for an appointment, especially if a patient has symptoms that might suggest a serious condition. Therefore, instead of just booking appointments months ahead, we run a triage service staffed by senior GPs and care coordinators so that all requests for consultations or other medical queries can be reviewed promptly. This is called Anima. This allows us to direct patients to appropriate local community health providers like pharmacists and musculoskeletal practitioners, freeing up GP appointments for those who need them. We can also arrange urgent appointments for those with more concerning symptoms. We do all this to make sure you get the right care when you need it. If you want to request an appointment with us, then please go on our Anima website to make your request. If you can't use a computer, then please do phone the surgery and speak to a receptionist. All requests by phone are filtered into the Anima system and your care will be prioritised in the same way. If you'd like to find out more about what happens when you submit an Anima, please have a look at our website.
If you're a parent and you're concerned about your child, you can use a symptom checker on the Healthier Together website. There's also a link to download the Healthier Together app. This allows you to create a secure profile for each child, easily check your child's symptom and get advice on what to do. The app will also directly message us at the surgery, allowing you to get advice from your GP. The website also has advice about managing your own conditions such as blood pressure, earwax and physio exercises. It also explains what you should expect after you've been referred to a specialist and what you should do if you have any questions. You can also directly order prescriptions from the website.
If you would previously have booked an appointment with your GP, we would now suggest that you make a request through our online consultation service called Anima. More than 70% of our patients are already registered with Anima. All Animas will be looked at and we'll get back to you by the end of the next working day. The GP may be able to recommend you have some investigations prior to your consultation, which might also speed up your care. They will also prioritise patients with more urgent conditions to make sure these consultations are arranged as soon as possible.
The Anima questionnaires are designed to give the GP enough information to make informed decisions about your care. We appreciate they might sometimes feel quite long. Answering no to a question can be as important as answering yes to your GP. Answering the question about how your condition is affecting you can be helpful as we try to prioritise consultations where symptoms are affecting you most. If you can't find the right questionnaire heading, use My Problem Isn't Listed. But remember, symptom-specific questionnaires are most useful to your GP. Although it may feel as though it's just a simple question, there are usually no simple answers. Every question needs to be reviewed and considered carefully by a GP.
Using Anima avoids waiting on the phones and giving information to a receptionist. It opens at 6:30 a.m. every day that the surgery is open, so you can submit your request before our phone lines open. If you can use Anima, it means that the phone lines are freed up for patients who are unable to use online services. Plus, you can upload photos of your condition so that the GP can see the symptoms if they are visual.
Please don't be put off that you're unable to book an appointment in the way that you used to.
If you have any questions or problems, we also host roadshows to help people get set up on Anima and support ongoing use.
Lastly, we have our urgent care service. That's when you need urgent but not emergency help. Our urgent care team offer 400 consultations every week and respond to 96% of requests within 2 hours. Our urgent care team consists of GPs and advanced nurse practitioners. We ask you to call in the morning, as calling later may mean we cannot see you on the same day.
We ask patients to phone in and not wait in reception, as the next appointment may not be till later in the day. This avoids patients having to wait in reception.
The receptionist will ask you questions about your condition and whether you feel that it is urgent for today. The receptionists are trained by the NHS National Training Programme, and they will be able to direct you to the most appropriate service depending on your requirements. The information that you provide will enable the urgent care service to prioritise your care.
Please remember, GP appointments are not an emergency service, and so all appointments are pre-arranged. If you have an emergency, such as concerns about heart attack or stroke, you must call 999.
Over the last 5 years, investment in general practice has focused on bringing in a wider group of professionals to work alongside your GP.
As we have a wider care team, many urgent conditions can be managed by other healthcare practitioners, such as a pharmacist who can prescribe antibiotics if needed. You can also self-refer to the urgent eye condition service and our first contact physios.
By using these services, patients are often seen more quickly and with more specialised care. This allows your GP more time and continuity to deal with patients with more complex health needs, such as Parkinson's disease or cancer.
We want the same for our patients, the best healthcare as fast as possible and as easily accessible. Work with us to help us achieve this. Thank you for your understanding and cooperation. Together we can ensure the best possible care for everyone.